Yeah, I think what you're seeing here is just simply the limitations of a human provider versus an AI that never fatigues, is always available. And you see that both in terms of the quality metric and the empathy metric. Take an example of one of the questions in our study was a patient had swallowed a toothpick and they were concerned about, they might have a puncture and bleed and what should they do? And the physician rightly responded, that's a very unlikely outcome. Don't worry about it. The AI was able to reveal all the considerations that went into that same response. Like the likelihood of this happening is this. And if you have these symptoms, then you might want to go to the ER and talk to them. But don't worry, toothpicks aren't going to hurt you. And echoing back that the patient was concerned and that the patient, felt worried, and understanding that, doctors are trying to persuade patients to do what's in the patient's own self-interest, even though everything's pulling them in the other direction. And so we can start thinking about not only what is good content for messaging, but what types of messages are potentially the most persuasive. And we can do that by looking at clinical endpoints, for example.